Hiya Ken, you alright?
Good, thank you.
Okay, so I brought you in today just to have a bit of a chat and follow up our assessment last week, because I think sometimes we throw assessments and we throw diagnoses that year and all these things and we don't really explain where we're going with it. Okay, so we'll talk you through sort of what I found in the treatment plan and go through your diagnosis. Okay, does that sound alright?
Yeah.
So you've been diagnosed with osteoarthritis. Okay, now this is a long-term condition, alright? So unfortunately, with long-term conditions, there's no set cure for it, okay? But there's certainly things that we can do to help improve and manage the symptoms that you have, okay? So osteoarthritis is basically the wearing bone, okay? So you have it in your hip joint. So with you, if you can imagine this is your hip joint, okay, so you have a bit of wearing at the end of your thigh bone, alright, where the bone meets the joint, and then a little bit of wearing within the socket itself, okay. So you've got a protective layer of cartilage that sort of protects the bone and protects against any friction as your joint moves around. So at the moment you've got that's being worn away, okay, and sometimes it can start to wear away a little bit of the bone, okay, the end of the bone. Alright, the body then tries to heal itself, so it sends down sort of material to make new bone, but then what can happen is that it sort of forms unevenly because there's no real regulation for it in your body. Okay, so at the moment you don't really have anything to prevent the friction between the two surfaces. So every time you're moving, you're creating friction, and that's where you're getting the pain. And that's why when you're saying about the sort of you feel like it's grinding a little bit, it's probably because that cartilage just isn't quite there anymore. Okay. Now, a great way of managing osteoarthritis and some of the symptoms that you're having is through exercise, okay? So understand, feel free to correct if I'm wrong, but your pain at the moment is manageable at rest, because your pain medication for your pain is okay. Now, with these types of conditions, you've got all different types of management, so I'm more about the physical sort of management of it. But if there's any time where you feel like your pain medication isn't quite sufficient or it isn't really working for you, you need to have a word with your GP, and we can try other things, okay? I'm looking at more your pain when you're doing things, okay, and understand that at the moment you're having problems with your walking and the things that you're doing around the house, and that's certainly where I come in, okay? Another way to help with your pain therapeutically, so without any kind of medication, is heat therapy. I don't know if you've tried that.
Yeah, I've tried it before.
Yeah, so just because you're walking a little bit differently to protect that hip joint, sometimes you start getting aches and pains all around in different areas of your body, okay? Heat's a really good way of letting those muscles just relax, and sometimes just tighten up a little bit because you're in pain, but also you're using them in different ways, okay? Showers and baths are probably a little bit better than heat packs, just because you can get an overall sort of relaxation of the muscles, where with heat packs you're sort of relying on one certain area, okay? In terms of sort of your exercise tolerance, what we're looking for the plan at the moment is to start with a home-based exercise plan, working with me 1 or twice a week, and then a little bit of homework to do just on your own or with a friend, entirely up to you, okay? Looking at improving the range of movement that you have, because you're limited in both hip joints at the moment, and looking at your overall strength in your lower limbs or your legs, and then also trying to increase how much sort of you're doing on your feet, so how much you're walking, like your aerobic system, so all your heart and your lungs, okay? By helping with working out your range of movement, it stops you becoming too stiff, so we want to try and get you a little bit looser, okay? That'll help with your overall strength as well, okay? And then we're looking at improving your strength, so improving your quads, so the big muscle around the top of your thigh, and then your hamstring, which runs along the back, can help protect that hip joint, okay? It can help take away some of the shock when you're walking, so you get a little bit of shock come through your body, and it can help just disperse with that, okay? So it's all about supporting the joint. Okay, and then we'll also look at your aerobic system, so just helping overall with your lungs as well. Okay, a little bit of trial and error. All right, we're looking at the best way to fit everything into your life. It's very much sort of we're working as a team here. Okay, because this is something you're going to have to do way after I stop working with you. So with me, it's going to be once, twice a week for the next 8 weeks or so. But this is something you're going to have to continue throughout your life, really, just so that you can manage the condition, okay? And we're going to also look at little coping strategies to understand you get stiff when you sit down in the chair. Okay, there's something you probably haven't thought about, but it's my job, so I have to. So it's things like maybe doing a little program just during the adverts when you're watching TV, so that you're sort of loosening off every time, say, the adverts come on. You're doing a little program, keep your joints moving, so that when you do have to move, it's not painful. Because what happens a lot with osteoarthritis sufferers don't like to move because obviously it's sore. Things then get really stiff and tight, and then it becomes a vicious circle, because when you do have to move and you do have to do things, it's even more sore to start with because it's so stiff and tight to begin with. Okay. And that's where I come in. So I'm looking at giving you the right information, all the information that you need. If you have any questions through the treatment plan, like what we're going to be working together through, to give you everything so that long after I'm gone, you can continue with things and you understand. And we're going to look at what maybe triggers you, so what causes a little bit of a flare-up. Is it sitting too long? Is it certain types of exercise? Is it walking uphill? Is it walking downhill? Okay. And then finding the best route to introduce more physical activity into your life. Okay? So like I say, in the planet phase, individual home program, and then we'll be looking at range of movement and strength, and then we're going to look at maybe referring you over to sort of exercise programs and gym referrals in the community. Okay, you've got great sort of resources here. Okay, could maybe try things like swimming, things or sort of cycling, things like that. So. But it's up to you, and it's something that we can decide together as we go through things. How's that sound?
Yeah, sounds great, yeah.
Alright, okay, thanks for your time. There's an information sheet just telling you sort of a little bit about what to expect in the next session. Okay,
Thank you.